Hi, I'm Tressa Moyle. I'm the director for the Center for Addictions at Cox North Hospital, and I'm going to be just sharing some information with you today about drug and alcohol abuse and about treatment options and some of the things that we do at the Center for Addictions that might be helpful to you or of interest to you. And so what I'd like to start out talking about is the fact that we treat addiction from a medical standpoint. So in 1956, the American Medical Association recognized addiction as a disease. And what that means is that we know that just like other diseases like diabetes or some other chronic health conditions, it meets certain criteria, such as it's chronic, which means it lasts a very long time, it's progressive, meaning it gets worse over time, and it also has symptoms that are predictable and treatable. And so as such, based on some research that was done in the 1940s and the 1950s, the American Medical Association did declare alcoholism and addiction to be a disease. And so at Center for Addictions, we work from a medical model, and we utilize a team that includes a medical team of 3 physicians and a nurse, as well as our therapists, social workers, and counselors. We talk about 8 major life areas that we know are greatly impacted by substance abuse. The first one is your medical health. So physical health is affected in many areas when you are looking at drug and alcohol use. And the physical effects of a substance are going to be different based on whatever the substance is that you're using, and we'll go into that a little bit later. But we know that many of the major organs are affected by substance abuse in negative ways. We also know that your mental health is affected. So that's the second area, is mental health. So we know that folks who are abusing substances such as alcohol, stimulants, pain medications, marijuana, oftentimes exhibit greater signs and symptoms of depression, anxiety disorders, as well as some other conditions that are made worse by substance abuse. We also know that the risk of suicide is twice as high in those people who are abusing substances as those who are not. The third area that we look at is the family. So our families are greatly affected by substance abuse. We know that people don't live in a bubble. So we are not individuals who go about life just kind of living in a cube, living in an environment. Everything we do affects everyone around us. So it affects the person at the grocery store, it affects the person that we are working next to, it affects our employer, our family members, our friends. It affects all of those areas. So family is one of the biggest things that we like to focus on in treatment, is making sure that your family members are getting support and education, as well as the services that we offer to the patient who comes into the program. Families are oftentimes experiencing some of the same things that you are if you are also engaging in substance abuse. So there is a higher incidence of mental illness, there is a higher incidence of stress and anxiety. They really struggle with things like guilt and resentment and suspicion. Lots of those same kinds of things that our patients are dealing with, our family members are also going to be struggling with. And so we make sure that we involve a big family component in our treatment. The third area that's affected is your social settings. And so we often notice that people who are struggling with alcohol or drug addiction will start to isolate, and they will pull back from their family, or they will pull back from the friends that they were engaging with, and they will start either isolating and spending a lot of time alone, or they will begin to spend time only with other people who are also experiencing substance use, because they know that there will be less judgment there, that they will feel more accepted in those areas. And so what happens is they tend to start pulling away from healthier relationships and start engaging in unhealthy relationships. The next area that we look at is employment or school. So employment is huge. We get a lot of referrals into our program from employers. A person who may be injured on the job and they have a post-accident drug screen that comes up positive for a certain substance, or maybe you've gone to your employer and said, hey, I'm struggling with something, can we take a look at some options, and an employer will refer them to us. Other times there may be job performance issues where your employer just recognizes that something's not working, that you're struggling with something, and they visit with you and you're able to tell them that something else is going on. Employment can be affected in lots of different ways: tardiness, absences, or basic job performance issues. We really try to work with individuals who are employed and allow them to come into the program while at the same time maintaining their employment, because we know that that is a huge part of your life. And so we don't want to risk financial issues for you. We don't want to risk your, maintaining your employment. And so we offer options, which we'll go into a little later, that would work around a work schedule and allow you to get the support that you need, to come in and speak with somebody, to ask questions, and not be concerned that you were jeopardizing your job. The next thing we look at is financial. Obviously, if you are using substances, you're spending money on the substance itself, but we also know that there are many consequences that come into play with court costs if there have been any legal issues, as well as the cost of treatment, the cost of physician visits. We know that people who are struggling with substance use have increased visits to the ERs, to their physicians, to counselors, things like that. And so you have those costs related to that as well. Plus costs that we don't often think about, things like higher insurance rates, higher premiums, and things like that. So there's a big financial impact of substance abuse as well. I mentioned legal. Many of our patients have experienced some legal issues from DWIs all the way to up to assault charges or more significant things. And so we do work a lot with the probation and parole system. If we have patients who are under some kind of supervision, we can work with your officers to make sure that they know that you're coming into treatment, that you're getting supportive services, and we can collaborate with them, to kind of help keep you in good status with them as well. And then the last one is spiritual health. And so many of our patients struggle just with feeling like they have some difficulty knowing what their purpose is in life, understanding what their meaning is, that they're here for a greater purpose. Maybe they don't feel grounded anymore. Maybe they feel a little lost. And so we really focus a lot on that in treatment. How do we help get you reconnected and help get you grounded and help you understand that you are a part of a bigger environment and a part of the bigger piece of the puzzle? So one of the things that people often ask us when they come into the program is, how do I know if it's a problem? And there are lots of ways that we can define substance abuse as a problem. We look at specific criteria medically that we can identify to tell you whether or not you meet the actual diagnostic criteria for a disease. And we have two different avenues that we can go with that. But what I always tell patients is, if you're noticing a problem in any area of your life, if any of those 8 areas have been impacted in some way, then it's a problem. And whether it meets the full criteria for the disease or not, full criteria for the definitions or not, if it's a problem, it's a problem. And I think what most people don't know and don't understand is that there is help out there that is very confidential, that is very discreet, and that is very available to you. I think most people picture treatment looking like things that they've seen in the movie, and in reality, treatment is much, much different than that. So we have an outpatient treatment program at Center for Addictions, and the reason we provide outpatient treatment options is because we know that people who want to come to treatment don't want to have to worry about confidentiality, about explaining to people where they have been. When you think about a residential program where someone goes away for 30 days, then there's a lot of information that you have to kind of explain to people. Where have you been for a month? Why weren't you working for a month? What was going on? And it just arouses suspicion, and I think sometimes that keeps people from wanting to come into treatment. We know that there are some people who absolutely can benefit from a residential treatment component. If somebody has tried an outpatient program and has really struggled and not been able to stay sober in a program, then we will look at some residential options for them outside of our system. But what we have found is that most people do very well in an outpatient treatment setting. Years ago, residential was kind of the treatment of choice for people, and you went away for 30 days and you came home. And things started changing in the early 1990s when managed care came into play. And it was kind of a happy accident that we learned that outpatient treatment is actually more effective and more beneficial, because it allows you to do those things I talked about. You can keep working. You don't have to have the financial impact of not having your income for 30 days. You don't have to explain to anyone where you've been for a month. Your family gets to see change as it happens. You get to practice the things you're learning in treatment when you go home at night. So we really have found that the model that we use now is actually the most beneficial for most people. So we offer various levels of care, all the way from what we call a partial hospitalization program, where a patient comes into the program for approximately 35 hours a week. It's Monday through Friday. It's from 9 to 3:30 plus another hour or two a week of some individualized therapies. And that level of care really is designed for somebody who is really struggling to the point where they can't maintain employment right now, where maybe they've had a lot of absences or tardiness, and we really need to provide some solid stability. The next level of care is what we call intensive outpatient, and that is our most popular level of care. That is the program that we put most of our patients into. Intensive outpatient treatment ranges anywhere from 10 to 20 hours per week. A minimum of 3 days per week, up to 5 days a week. And the nice thing about our intensive outpatient program is that it is the one that is the most flexible. So we have a morning program from 9 to 12:45. We have an afternoon program from 11 to 3:30. We have a midday program that we can do from around 10 to 2:30. And then we have an evening program from 5:30 to 8:30. So we have options that really can work around almost any kind of an employment schedule. And we have patients who come in and they kind of hop around between those 4 programs. Maybe on a Monday they'll come in the evening, and on Tuesday they come in the morning because maybe they have a schedule at work that needs that kind of flexibility. So it really is a very flexible option for folks to be able to access the support that they need. We know that treatment works. We know that there are many barriers to people getting into treatment. Many people are concerned about the financial impact of coming to treatment, how much it will cost. Most insurance companies do cover treatment, and so you'd be looking at some co-pays or maybe your deductible and co-insurance amounts, but for many people, treatment can be very, very affordable. Some other barriers are just the confidentiality factor. Our program at Center for Addictions is highly confidential. We cannot tell anyone you're there. We cannot identify you as a patient in any way, shape, or form. So there are lots of things in place to protect that for you if you were to come into the program. Your first step basically would be that if you were having any concerns or you just wanted to talk to someone, you can call us, you can make an appointment to come in and meet with one of our intake counselors. You can call our front desk at 269-2273. That stands for Cox Care, which is fairly easy to remember. And we would be happy to set up a time to come and talk with you. You're not committing to anything if you come in just to talk. So you don't have to come in ready to go. You can just come in with questions and we'll be happy to talk with you. Unfortunately, only about 10% of people who really need our services seek our services. And so, we would love it if more people would feel open and safe to come in and talk. We have a very stable staff. We've been open since 1984, and I have staff members on the unit who have been here for 20 years. So it's a very stable team of people with a lot of experience who are very ready to come in and talk with you and share information with you. Treatment is basically a combination of things. We have classes where we're teaching you about drugs and alcohol. We're teaching coping skills. We're talking about relapse prevention. Every patient who comes into the program gets individual therapy one-on-one with a counselor once a week while they're in the program, and they get group therapy at least once a day, possibly twice a day. So you have an opportunity to really get in and process some of the things that you're struggling with and have someone guide you in that process of what it's like to look at sobriety and to look at your life in a different way. We also provide case management services where we will help you identify other resources in the community that might be helpful to you, as well as family therapy and introduction to 12-step support groups, which might be a benefit to you in long-term sobriety. So treatment can be comprised of a lot of different things, and like I said, it's usually 10 to 20 hours a week in that intensive outpatient program, and that lasts approximately 6 to 8 weeks. After you complete what we call primary treatment, then we move you into our aftercare program, and our aftercare program is free of charge to you for the rest of your life. So you would have ongoing support through our program for as long as you need it. We recommend a minimum of once a week for 6 months, and then after that, just as often as needed. The majority of our patients that come into our program are struggling with opiate addiction, and that is the biggest thing that we deal with right now. So lots of heroin abuse, lots of prescription drug abuse. Many patients who started on prescription drugs for legitimate reasons, but have now found themselves to be in a little bit of trouble and need some help come into our program. Our number 2 drug of choice would be alcohol, and then followed by marijuana. But we also get patients who are struggling with methamphetamine, with cocaine, with lots of other types of addiction, other prescription medications, and we can address any of those issues. We have 3 physicians on staff who are trained and certified in addiction medicine who can offer medical interventions if needed. If you actually need an inpatient detox, we can provide that for you. If you need outpatient medical detox, medications, those types of things, we can provide those as well. So I think that the biggest thing that I would like for you to have as a take home is that this is a very safe and confidential place for you to come and to ask questions. Also to know that if you go to your employer and ask for assistance, that they have access to resources. They can help refer you into the right programs. They can connect you with us. We can work with them to ensure job safety, to ensure that you're safe when it is time to return to work if you do need to take time off. But like I said, in most cases, you could continue to work while you come to treatment. So your representatives here at your company have access to our resources. You're welcome to contact them at any time, or you can contact us directly at 269-2273.